Bismillahirrahmanirrahim. I am Muhammad Ahmed. I'm a NAVLE certified veterinarian. If you want to ace your NAVLE and want to know about dilated cardiomyopathy in dog and cat, and then this video is for you. Watch this video till end, because in the end I will share a summary of the disease which you can understand by scanning. In my previous video, I talked about hypertrophic cardiomyopathy. So in connection to that, I will explain what is dilated cardiomyopathy. There are three things in it. There is thinning of myocardium, increase in the space of left ventricle, and systolic dysfunction. This disease is very rare in cats because previously it was linked with taurine deficiency, but now all commercial available foods have taurine in it. So the dogs which are susceptible to disease include Boxer, Cocker Spaniel, Great Dane, and Doberman Pinscher. So you can remember BCD as a numeric. I will explain about the pathophysiology, clinical signs, different diagnosis, ECG strip, treatment, management, and life expectancy. The pathophysiology include, as I earlier stated, thinning of the myocardium, increase of space in the left ventricle, and systolic dysfunction. Due to systolic dysfunction, the cardiac output will be reduced and the body will not be able to have oxygen. So the signs like exercise intolerance, lethargy, and fainting can be found with this disease. Secondly, the myocardium is not in the state to pump the blood in the body. The blood will back up into the left atrium and into the lungs, and the signs like coughing, tachypnea, dyspnea will also appear in this disease. A very interesting pattern of ECG is found in this disease, and that is ventricular premature complex. I will explain what is it in a very simple way. Usually, the electrical activity is initiated by SA node, but in VPC, the myocyte can have an electrical activity. So, during a QRS complex, myocyte will get excited and fire another electrical signal, due to which a broad and bizarre QRS complex will appear on the ECG. If the R of this new electrical signal gets on T of the previous signal or the sinus signal, then a life-threatening arrhythmias such as ventricular fibrillation can take place. In a breed of dog, as I explained earlier, Boxer, Great Dane, Cocker Spaniel, and Doberman Pinscher, if on an ECG the VPCs are occasional, then it is benign. But if they are consecutively 4 times, or with the Holter monitoring, there are more than 100 VPCs per 24 hour, then this is an indicative of DCM. If a Boxer comes to you with a complaint of fainting, then you should put Holter on it, and the 24-hour heart rhythm will appear on it, and this will tell. If the VPCs are more than 100 in 24 hours, then it is suggestive of DCM. Similarly, in Doberman, the disease does not appear, but there are electrical disruptions, so same Holter should be attached with the Doberman to check if there are VPCs or not. Treatment, let's analyze what are the events in the pathophysiology, and then the treatment is performed accordingly. Furosemide is given to reduce lung congestions. Pimobendan or Vetmedin is given, which has 2 effects. It is calcium sensitizer, will increase systolic function. Secondly, it will cause vasodilation and will reduce afterload. The definitive diagnosis is electrocardiography, but on the X-ray, you will find a circular or a globular heart, which is suggestive of DCM in a large breed. Another test is NT-proBNP, which can also aid diagnosis, but it's not confirmatory. It's the only electrocardiography where there will be a dilated heart with thin myocardium. The quick recap is, it is a disease of large breeds. It is characterized by thinning of myocardium and systolic dysfunction, can be traced on ECG as per VPCs. The definitive diagnosis is echocardiography, and treatment is to reduce congestion of the lungs with furosemide and using drugs like Vetmedin or Pimobendan that reduces afterload and increases cardiac output. If you connect all these dots, you will be able to crack this disease meticulously.